Has the spark in your bedroom started to dim, leaving you feeling frustrated, inadequate, or even embarrassed? Are those once spontaneous moments now overshadowed by a gnawing worry about your performance, or perhaps a complete absence of desire? If you're an older man, this isn't just about a decline in sexual activity. It's a profound pain point that resonates deeply, often whispered about in hushed tones, if at all. It's a silent anxiety that settles in when your body doesn't respond the way it used to, or when your interest in intimacy wanes unexpectedly. This isn't just a matter of getting older or a minor inconvenience. Ignoring persistent bedroom problems can be a blaring alarm bell, signaling underlying health issues far more serious than a flagging libido. The good news is, understanding this connection is the first powerful step towards regaining not just your intimate life, but your overall vitality and well-being. The solutions are within reach, and they're more comprehensive than you might imagine. Before we dive deep into the often overlooked connection between bedroom problems and overall health in older men, if you're looking for a community dedicated to embracing every stage of life with wisdom, joy, and practical strategies, make sure to hit that subscribe button right now on Aging Gracefully 60. We're here to guide you through the journey of aging, not just gracefully, but powerfully. One of the most common and distressing bedroom problems older men face is erectile dysfunction, or ED. This isn't just about the occasional difficulty. We're talking about a consistent inability to achieve or maintain an erection firm enough for satisfying sexual activity. The pain point here is multifaceted. There's the emotional toll, the frustration, the self-doubt, the feeling of letting down a partner, and the erosion of self-esteem. Imagine the scene. Anticipation builds, but then nothing, or perhaps a fleeting response, quickly lost. This can lead to a man withdrawing from intimacy altogether, creating a rift in relationships that once brought joy and connection. The psychological impact can be profound, fostering anxiety, depression, and even a sense of emasculation. Beyond the immediate bedroom frustration, the insidious nature of ED lies in its role as a potential harbinger. It's a cruel irony that the very vessels crucial for an erection are the same ones that supply blood to your heart and brain. When these vessels become compromised, the delicate, smaller arteries in the penis are often the first to show symptoms, long before the larger arteries supplying the heart or brain. Thus, ED frequently serves as an early warning sign of cardiovascular disease, including heart attack and stroke. It can also be a red flag for diabetes, high blood pressure, and high cholesterol. The silence surrounding ED often prevents men from seeking help, delaying a diagnosis that could be life-saving. The antidote to this pervasive problem begins with an open conversation, both with your partner and, crucially, with your doctor. The first step towards a solution is acknowledging the issue and seeking professional medical advice. A comprehensive medical evaluation is essential to identify any underlying health conditions contributing to ED. This will likely involve blood tests to check for diabetes, cholesterol levels, and hormone imbalances, like low testosterone. Your doctor will also assess your cardiovascular health. Once the underlying cause is identified, the solutions can be tailored. For many, lifestyle modifications are paramount. This includes adopting a heart-healthy diet rich in fruits, vegetables, and lean proteins, and reducing saturated fats and processed foods. Regular physical activity, even moderate exercise like brisk walking for 30 minutes most days of the week, can significantly improve blood flow and overall vascular health. Quitting smoking is non-negotiable, as smoking severely damages blood vessels. Managing stress through techniques like mindfulness, meditation, or hobbies can also play a role, as stress and anxiety can exacerbate ED. In some cases, medications such as PDE5 inhibitors, e.g. sildenafil, tadalafil, may be prescribed, but these should always be taken under medical supervision, as they are not suitable for everyone and don't address the root cause. Furthermore, addressing psychological factors through counseling or sex therapy can be incredibly beneficial, especially when performance anxiety or relationship issues are contributing to the problem. It's a journey of understanding your body, taking proactive steps, and recognizing that seeking help is a sign of strength, not weakness. Beyond the mechanics of an erection, another profound bedroom problem older men frequently encounter is a significant decline in libido, or sexual desire. This isn't about being unable to perform, but rather a pervasive lack of interest in sex altogether. The pain point here is often an unspoken one, a quiet sadness that settles in. It can manifest as a sense of detachment, a feeling of losing a vital part of one's identity, or a disconnect from a partner who still desires intimacy. Imagine the quiet nights, the subtle avoidance of physical closeness, and the internal struggle as a man grapples with this inexplicable shift. It can lead to feelings of guilt, shame, and inadequacy, causing a man to distance himself emotionally from his partner, creating a chasm in the relationship. This decline in desire isn't just about a loss of pleasure. It can erode the emotional intimacy and shared connection that are so crucial in long-term relationships. Furthermore, a consistently low libido can be a critical indicator of hormonal imbalances, particularly low testosterone, often referred to as low T. While testosterone naturally declines with age, an abnormally low level can impact not just sexual desire, but also energy levels, mood, muscle mass, and bone density. Other medical conditions, such as chronic fatigue, depression, thyroid disorders, and certain medications, like antidepressants or blood pressure drugs, can also significantly suppress libido. Ignoring the symptom means potentially overlooking serious physiological or psychological issues that demand attention. The strategy for reigniting desire often involves a multi-pronged approach, starting with a thorough medical evaluation to identify and address any underlying causes. Blood tests to check hormone levels, particularly testosterone, are crucial. If low testosterone is diagnosed, your doctor might discuss testosterone replacement therapy, TRT, though this decision requires careful consideration of potential risks and benefits. It's important to note that TRT is not a universal solution and should only be pursued under strict medical guidance. Beyond hormonal factors, reviewing all current medications with your doctor is essential, as some drugs can significantly impact libido. Don't hesitate to ask if any of your prescriptions could be contributing to the problem. Lifestyle adjustments are also powerful allies. Regular physical activity has been shown to boost energy levels, improve mood, and enhance overall well-being, all of which can positively impact sexual desire. A balanced diet, adequate sleep, and stress management techniques are equally important. Furthermore, addressing psychological factors is key. Open communication with your partner about your feelings and challenges can alleviate pressure and foster understanding. Seeking counseling, either individually or as a couple, can help explore underlying emotional issues, relationship dynamics, or past traumas that might be affecting desire. Sometimes, rekindling intimacy involves exploring new forms of closeness, focusing on non-sexual touch, affection, and shared activities to rebuild connection and desire gradually. It's about nurturing the physical and emotional landscape of your life, understanding that desire is a complex interplay of many factors, and taking proactive steps to cultivate it. Another challenging bedroom problem that older men, perhaps surprisingly, can continue to experience or even develop is premature ejaculation, PE. While often associated with younger men, PE can persist or emerge in later life, causing significant distress. The pain point here is the profound sense of losing control, the feeling of inadequacy, and the frustration of unsatisfying encounters for both partners. Imagine the swift, unanticipated climax, leaving one or both partners feeling unfulfilled, disappointed, and sometimes even resentful. This can lead to avoidance of intimacy, further exacerbating relationship strain. The man might experience heightened anxiety during sexual encounters, creating a self-fulfilling prophecy of premature ejaculation. While the exact causes of PE aren't always clear, a combination of psychological and biological factors often plays a role. Psychologically, anxiety, stress, performance pressure, or a history of conditioning can contribute. Biologically, issues such as abnormal levels of certain neurotransmitters, like serotonin, thyroid problems, inflammation or infection of the prostate or urethra, or nerve damage can be implicated. Ignoring PE means living with persistent frustration, relationship dissatisfaction, and potentially overlooking underlying medical conditions that are contributing to the problem. If you're still with me, comment one thing related to the video, and the support means a lot. And also, so that you don't miss another video, by Aging Gracefully 60. The solution to premature ejaculation often involves a combination of behavioral techniques, psychological strategies, and sometimes medication. Behavioral techniques are often the first line of defense. The start-stop method involves stimulating yourself or your partner to the point of nearly ejaculating, then stopping stimulation until the arousal subsides, and repeating this cycle multiple times before allowing ejaculation. The squeeze technique is similar, where you or your partner gently squeeze the tip of the penis when you feel close to orgasm, reducing the urge. These techniques help a man gain greater control over his ejaculatory reflex. Pelvic floor exercises, often associated with urinary control, can also strengthen the muscles involved in ejaculation, potentially aiding control. Psychologically, reducing anxiety and performance pressure is crucial. Open communication with your partner about the issue can significantly reduce stress and foster a supportive environment. Counseling or sex therapy can provide strategies for managing anxiety, improving communication, and exploring any underlying psychological factors. In some cases, a doctor might prescribe topical anesthetic creams to reduce sensitivity or certain oral medications, such as selective serotonin reuptake inhibitors (SSRIs), which have a side effect of delaying ejaculation. These medications are typically used off-label for PE and require careful medical supervision. Addressing any underlying medical conditions, such as thyroid issues or prostate problems, is also vital. It's about building a repertoire of techniques and strategies, and recognizing that with patience and effort, control can be regained, leading to more satisfying intimate experiences. For older men, pain during intercourse or dyspareunia is a less frequently discussed but significant bedroom problem. While more commonly associated with women, men can also experience discomfort or pain, turning what should be a pleasurable act into a source of dread. The pain point here is the immediate aversion to intimacy that develops when pleasure is replaced by discomfort. Imagine the hesitant approach, the attempt to ignore the twinge, and ultimately, the withdrawal that follows. This can lead to a complete avoidance of sexual activity, impacting not just physical intimacy, but also the emotional closeness of a relationship. The man may feel embarrassed, unwilling to discuss the pain, and isolate himself further. This discomfort can manifest in various ways: a burning sensation, sharp pain, aching or soreness in the penis, testicles, perineum, or even within the prostate area. Ignoring this pain is dangerous, as it is almost always a sign of an underlying medical issue. Potential causes include infections, such as prostatitis, urinary tract infections, or sexually transmitted infections, inflammation like balanitis, Peyronie's disease, a condition causing scar tissue inside the penis, leading to painful curvature, nerve damage, skin conditions, or even certain medications. Prostate problems, common in older men, can also cause referred pain during or after ejaculation. Failing to address this pain means enduring unnecessary suffering and risking the progression of an undiagnosed medical condition. The solution to pain during intercourse hinges entirely on accurate diagnosis and treatment of the underlying cause. The first and most critical step is to consult a doctor, specifically a urologist, to identify the source of the pain. This will likely involve a physical examination, discussions about the nature and location of the pain, and potentially tests such as urine analysis, blood tests, or imaging scans to rule out infections, inflammation, or structural abnormalities. Once the cause is identified, the treatment can be targeted. For infections, antibiotics are typically prescribed. If inflammation is present, anti-inflammatory medications may be used. For conditions like Peyronie's disease, various treatments are available, ranging from medication to injections, and, in some cases, surgery. Addressing skin conditions or nerve issues would involve specific dermatological or neurological treatments. If prostate problems are contributing to the pain, treatments for benign prostatic hyperplasia, BPH, or other prostate conditions would be initiated. Lubrication is also a simple yet often overlooked factor that can alleviate discomfort, particularly if vaginal dryness in a female partner is contributing to friction. Open and honest communication with your partner about the pain is vital. Understanding and empathy from both sides can make the journey to diagnosis and treatment less stressful. It's about recognizing that pain is a signal from your body that something is amiss and taking decisive action to resolve it, reclaiming intimacy as a source of pleasure and connection. The disappearance of morning erections or nocturnal penile tumescence (NPT) is a subtle but often distressing bedroom problem for older men. Many men take these spontaneous erections for granted, associating them with youth and vitality. Their absence can trigger anxiety and raise concerns about overall sexual function. The pain point here is often a quiet realization, a growing unease as this once regular occurrence becomes a rarity or vanishes altogether. Imagine waking up morning after morning, noticing the lack of the familiar sensation and the creeping worry that something fundamental has changed. It's a psychological blow, contributing to feelings of aging and a loss of sexual potency. While morning erections are often a natural byproduct of REM sleep cycles, their consistent absence can be a significant indicator. They serve as a natural diagnostic tool, demonstrating whether the physiological mechanisms for erection are still functional. If a man experiences no morning erections but can achieve erections at other times, it might suggest a psychological component to his ED. However, if morning erections are consistently absent alongside difficulties with erections at other times, it strongly suggests a physiological problem, such as vascular issues, nerve damage, or low testosterone. Ignoring the loss of morning erections means missing a key diagnostic clue that could point to serious underlying health problems, particularly cardiovascular disease. The strategy for addressing the loss of morning erections starts with observing the pattern and then consulting a healthcare professional. While not a standalone medical condition, its absence is a crucial piece of the puzzle in diagnosing erectile dysfunction. Your doctor will likely want to assess your overall health, focusing on cardiovascular risk factors, hormonal balance, and neurological function. Tests similar to those for ED, including blood tests for cholesterol, blood sugar, and testosterone levels, will be performed. If a physiological cause like vascular disease or low testosterone is identified, the solutions would mirror those for ED and low libido. Lifestyle modifications, such as a heart-healthy diet, regular exercise, smoking cessation, and weight management. These are vital for improving overall vascular health and blood flow. If low testosterone is a factor, your doctor may discuss testosterone replacement therapy. Sometimes medications for ED, such as PDE5 inhibitors, can help restore morning erections by improving blood flow. But again, these treat the symptom rather than the root cause and should only be used under medical supervision. Furthermore, addressing psychological factors like stress, anxiety, or depression through counseling or stress management techniques can also contribute to the return of morning erections. It's about paying attention to your body's subtle signals, understanding their significance, and taking proactive steps to investigate and address any underlying health concerns they might be revealing. The experience of pain or discomfort immediately following orgasm and ejaculation is another bedroom problem that older men sometimes face, turning the peak of pleasure into a moment of distress. The pain point here is the jarring transition from satisfaction to soreness, aching, or even sharp pain. Imagine the shared intimacy, the release, only to be followed by a persistent discomfort that lingers, sometimes for hours. This can lead to a man actively avoiding ejaculation, which in turn can lead to a decrease in overall sexual activity and intimacy. The man might internalize this pain, fearing it's a sign of serious illness, and this fear can become a barrier to future sexual encounters. The location of this post-orgasmic pain can vary, from the penis itself to the perineum, testicles, lower abdomen, or even the lower back. This symptom should never be ignored, as it often indicates an underlying medical condition. Common causes include chronic prostatitis, inflammation of the prostate gland, epididymitis, inflammation of the epididymis, a tube located at the back of a testicle, seminal vesiculitis, inflammation of the seminal vesicles, muscle spasms in the pelvic floor, nerve entrapment, or even a herniated disc. It can also be related to changes in the prostate with age, such as benign prostatic hyperplasia, BPH, particularly if the prostate is inflamed or irritated. Ignoring this pain risks exacerbating the underlying condition and perpetuating a cycle of discomfort and avoidance. The strategy for resolving post-orgasmic pain or discomfort begins with a thorough medical examination to pinpoint the cause. This will almost certainly involve a visit to a urologist who will conduct a physical examination, including a digital rectal exam to assess the prostate. Further investigations might include urine tests, semen analysis, cultures to check for infections, and sometimes imaging studies like ultrasound or MRI to visualize the prostate, seminal vesicles, and surrounding structures. Once the diagnosis is established, treatment can be initiated. If an infection is present, a course of antibiotics will be prescribed. For inflammation, anti-inflammatory medications or specific treatments for chronic pelvic pain syndrome might be employed. If prostate enlargement, BPH, is the underlying issue, medications to relax prostate muscles or shrink the gland may be used. Pelvic floor physical therapy can be incredibly beneficial if muscle spasms or nerve issues are contributing to the pain. This therapy involves exercises and techniques to relax and strengthen the pelvic floor muscles. Addressing stress and anxiety can also be helpful, as tension can exacerbate muscle-related pain. In rare cases, a doctor might explore nerve blocks or other interventional pain management techniques. It's about not accepting pain as a normal part of aging, but rather actively seeking a diagnosis and treatment to reclaim comfortable and satisfying intimate experiences. Beyond premature ejaculation, older men can also experience problems achieving orgasm or ejaculating, a condition known as delayed ejaculation or anejaculation. The pain point here is the profound sense of unfulfillment, the prolonged effort with no satisfactory release. Imagine the sustained sexual activity, the building arousal, only to find the climax frustratingly out of reach. This can lead to exhaustion, disappointment, and a deep sense of inadequacy for the man, and confusion or concern for his partner. It can make intimacy feel like a chore rather than a pleasure, eroding spontaneity and desire for both individuals. The man might feel a distinct pressure to finish, which paradoxically makes the problem worse. This difficulty can stem from various sources. Neurological conditions like Parkinson's disease, multiple sclerosis, or nerve damage from diabetes or surgery, e.g., prostate surgery, can interfere with the nerve signals required for ejaculation. Hormonal imbalances, particularly low testosterone, can also play a role. Certain medications, especially antidepressants, SSRIs, high blood pressure medications, and some prostate drugs, are well-known culprits for causing delayed or absent ejaculation as a side effect. Psychological factors such as anxiety, stress, performance pressure, or relationship issues can also significantly contribute. Ignoring this problem means accepting an unfulfilled intimate life and potentially overlooking a serious underlying neurological or systemic medical condition. Addressing difficulties with orgasm or ejaculation requires a systematic approach, starting with a comprehensive medical evaluation. Your doctor will likely review your complete medical history, paying close attention to any neurological conditions, surgeries, and current medications. A thorough physical and neurological examination will be performed, and blood tests may be ordered to check hormone levels and rule out conditions like diabetes. The most critical first step, if possible, is to review and adjust medications that might be causing the issue. Your doctor might be able to switch you to an alternative drug or adjust the dosage. If a neurological condition is identified as the cause, management of that condition will be paramount, and sometimes specific treatments can help. For hormonal imbalances like low testosterone, appropriate therapy might be considered. Psychological interventions are often highly effective. Counseling or sex therapy can help men explore underlying anxieties, performance pressures, or relationship dynamics that are contributing to the problem. Techniques to reduce self-consciousness and focus on pleasure rather than performance can be beneficial. Communication with your partner is vital. Understanding and patience can create a supportive environment. Sometimes, varying sexual techniques, focusing on different types of stimulation, or extending foreplay can help. It's about uncovering the root cause, whether it's physiological, psychological, or medication-induced, and then working collaboratively with your healthcare team to find solutions that allow for a fulfilling and satisfying intimate life. Perhaps you felt this too, that quiet, gnawing worry about what's happening in the bedroom. It's a reality many of us face as we navigate the journey of aging, isn't it? Think about how these challenges might apply to your own life or to someone you know. Imagine the difference it could make to proactively address these issues, to reclaim not just intimacy, but a sense of vitality and well-being. Doesn't that resonate with you? It's a simple truth, isn't it? Ignoring a problem rarely makes it go away. Often, it allows it to grow. As we've explored today, neglecting bedroom problems in older men isn't just about a diminished sex life. It's an invitation to cultivate resilience, embrace new possibilities, and truly live life to its fullest. These seemingly isolated issues, be it ED, low libido, premature ejaculation, pain during intercourse, loss of morning erections, or difficulties with orgasm, are often powerful, often silent, indicators of deeper health concerns. By understanding the common pitfalls and proactively applying these solutions, we empower ourselves to navigate the later stages of life with confidence and joy, embracing comprehensive health and understanding that all aspects of our well-being are interconnected. If this discussion resonated with you and you're ready to embrace aging as an adventure rather than an endpoint, then please take a moment to subscribe to Aging Gracefully 60. Your support helps us continue creating valuable content designed specifically for you. Hit that like button if you found this video helpful and share it with anyone you know who could benefit from these insights. And as always, remember to leave your thoughts and experiences in the comments below. Your perspective enriches our entire community. Together, we can redefine what it means to age gracefully.